The RS virus. What parents with babies need to know. Although the RS virus usually causes mild symptoms, there is a small chance that your baby will develop serious breathing problems from this virus. Here is some practical advice on how to protect your baby from the RS virus, and what to do if you suspect that your baby is infected. What is the RS virus? The RS virus is a common virus that causes respiratory infections. It mainly occurs when the R is in the month. The virus can lead to a cold or worse. In some young children and babies, it causes the lower respiratory tract infection bronchiolitis. This is a type of inflammation of the lungs. How do I know if my baby has the RS virus? You can't know for sure, and you don't need to. The most important thing is to keep a close eye on your child and seek help in time if you notice that your baby is having difficulty breathing, because that indicates a serious inflammation of the lungs. An RS virus infection usually starts with common cold symptoms: nasal congestion, runny nose, fever. If your child develops bronchiolitis, the above symptoms will not go away after a few days, except for the fever that can even drop. That is not a good sign, especially if you see or hear that your child has a lack of oxygen. You can see this from a gray loose skin around the mouth. Moves the nostrils while breathing, pulls in the chest while breathing. Breathes wheezing and sawing, sometimes stops breathing, is difficult to feed, and therefore drinks poorly. Breathes quickly. Urinates less, is drowsy. Sometimes hospital admission is necessary for supportive treatment. And that means the baby gets oxygen and possibly fluids via an IV. Is the baby in very bad shape? Then admission for artificial respiration is necessary. How can you protect your baby from the RS virus? Infection is almost impossible to prevent, especially not in a family situation where you live close together. Moreover, you are often contagious before you have any symptoms. Nevertheless, it is advisable to apply general measures to reduce the risk of serious RS virus infections in your baby. Try to keep brothers and sisters away from your baby during the first month after birth, as difficult as this may be. Always wash your hands thoroughly with soap and water before touching your baby, especially if your baby is younger than 6 months, because they are at extra risk. And make sure that any brothers and sisters also wash their hands if they are allowed to touch your baby, so before playing or cuddling. Limit visitors. If people do come over, ask them to wash their hands after coming in. Do not let people with a cold come near your baby if you know or think they have a cold. Ensure a smoke-free environment. Smoking increases the risk of serious RS virus infections, so don't let your baby exposed to smoke.